Welcome and thank you for joining us for this Facebook Live media conference. Today's presenters are Eric Day, Director of Clinton County Office of Emergency Services, Dr. Wouter Rietsma, CVPH Vice President of Population Health and Information Services, an infectious disease physician, Aaron Strife, Director of Healthcare Services for the Clinton County Health Department, and Lieutenant Nicholas Leon, Clinton County Sheriff's Office. Each will provide a brief update, and we will do our best to respond to your questions at the conclusion of those updates. Since we anticipate some questions on the same topic, please listen carefully, as the information you are seeking may be answered in the prepared remarks or as part of a combination of questions. And at this point, I'd like to invite Mr. Eric Day to the podium.
Thank you, Karen. Good morning. This morning, before my colleagues speak, I'd like to share a few words about our COVID-19 incident management team working in Clinton County, as well as the work of our logistics section has in particularly conducted, and lastly, the need for continued preparedness, safety, and vigilance. Our incident management team is working under the Incident Command System, an easily expandable federal model for managing complex emergency responses. The team at the county is comprised of over 40 members of command, general staff, operational division, and group levels, sharing information and coordinating with literally hundreds of healthcare, education, government, law enforcement, first responder, community action groups, charitable organizations, and more. Our logistics section, led by my own Assistant Director, Kelly Donahue, is working with many others to coordinate and fill gaps in the normal supply chain, as well as to develop facility needs for our greater response. Our team has ordered, received, and distributed personal protective equipment, or PPE as we're calling it, on the magnitude of tens of thousands of masks, gloves, gowns, and eye protection for healthcare workers across all sectors, including but not limited to CVPH, private medical provider offices, nursing homes, advocacy and resource center, school districts, social services, probation, airport, fire and EMS, law enforcement, first responders. It's important to note and to thank expressly those who have come forward and have been able to donate much needed PPE. Individuals and private organizations, fraternal organizations, and businesses of all kinds, including dental practices, have done so. Lastly, I'd like to take a moment to remind every citizen in our county and region, as this never-before-experienced marathon of an event continues, that we must all continue to be concerned and vigilant with everyday personal safety. As an example, despite the greatly reduced amount of travel due to closures, we continue to have motor vehicle accidents. Several days ago, we had a storm event that brought high winds, damaging electrical systems to our communities. These type of events continue. And most recently, as a tragic and fatal structure fire occurring just a couple of days ago in Plattsburgh underscores, we still face these everyday hazards and situations. The fire investigation being conducted by members of the New York State Office of Fire Prevention and Control, the New York State Police, and investigators from the Office of Emergency Services will likely reveal that the cause of the fire was accidental and that the team was unable to eliminate the potential careless disposal of smoking materials. This is an easily preventable yet common cause of fires in our region, and as stated, the incident underscores the need for all to be vigilant not only with social distancing, but with everyday safety. As we cope with impacts that COVID-19 has on our daily lives, I implore everyone to consider their personal actions and consider and practice best safety principles when driving, working, or simply conducting activities of normal daily living at home. Thank you, and now I would like to introduce to the podium one of our key partners working very hard for weeks now on our region's response, Dr. Wouter Rietsma, infectious disease physician and CVPH Vice President for Population Health and Information Services.
Thank you very much. Hopefully the audio is, been seeing some comments that people are struggling with the audio. I'll try to speak as loudly as possible. I first wanted to say a couple of thank yous. And the first thank you is to the clinical teams at the hospital. So, I have the opportunity to work with our incident command structure, but I'm not on the front lines. And I need to just say thank you to the doctors, to the nurses, to the environmental service people, to the dietary people, to all the people that are on the front lines that are providing care for our patients every day, and they're doing it with professionalism in a very anxiety-provoking time. The second thank you I want to do is to the community. We have had a tremendous amount of reach outs from the community in the form of thank yous, in the form of gratitude, but also in the form of donations. Lots of businesses have contributed protective equipment. We've had food donations. We are looking at a source of locally made face shields through one of our local schools that we will talk more about in the future days. So it's all really, I think it makes people feel very good to get those reach outs, whether it be donations or just thank yous. So keep those coming. Just an update about what's going on in our hospital right now. As of this morning, we had 6 confirmed positive patients in the hospital, 3 in our intensive care unit, and 3 not in intensive care. As of this morning, we had 5 persons who we call persons under investigation, PUIs. These are people who testing has been ordered, but it's not returned yet. And we have to date had no fatalities from COVID-19. Our testing, what we do know is for people that are admitted to the hospital where there's a suspicion of COVID-19 and we order tests, we have about 10% turning positive at this point in time. I think that there's a lot of concern. Nobody wants to admit someone to the hospital that might turn out to be COVID, so we tend to err on the side of caution. And then over the next 24 to 48 hours, we either get negative tests, or in some situations, the real diagnosis becomes very apparent, and we no longer treat that person as a potential case. We've tested in the hospital about 70 or 80 PUIs, I think. County-wide, I'll let the county talk about total tests. We're getting about 24 to 48 hour turnaround. All of our testing is from New York State lab, and I think part of our turnaround is just our limitation in driving the tests down more than anything. But they turn the tests around rapidly. We are well supplied with tests for our current testing strategy, and our strategy really is only testing people admitted to the hospital that we have concern, and then select other testing when we have perhaps an outbreak, concern, perhaps we have an employee that became sick while working and we might have to do a contact investigation. And we also are working with the health department when they have select patients where they have a real public health need for testing. So we're well supplied at this moment. We would love to go to a drive-up testing. We have we have a process that we can do, and I know the county has thought about a broader process, but at this point in time, we don't have access to enough kits to do that. If we opened it up, we'd probably run through our supply in a matter of a day or 2, maybe 3, given the pent-up demand that there is. As for our people, I think people are hanging in there. I think people need to understand that even at the hospital, however, we have people that are struggling financially because they're not necessarily working. So we had to close lots of services, and as a result, there are people that aren't currently working. We know who is and who's not. We have provided some help to people in the first few weeks, and we work very closely with our 2 labor unions to make sure that we can help our people as much as possible. We know that if the surge comes, we are going to need people. We also know that the people that are currently working, some of them will get sick, and so we need people to come in and work for them. All of the people that worked in services that are no longer open, we know their skill sets. We've started training certain people for other work within the hospital so that we can meet our surge plans. As I said, we've been working extremely closely with our partners and our 2 labor unions. It's really been a very productive relationship, trying to make sure that our people are as safe as can be, and trying to make sure that there is as we can reduce anxiety as much as possible. And in this environment, we're never going to get rid of all anxiety. We think that over time, even the people that aren't working will have work. Certainly, COVID has created a lot of new jobs. We have people that work at our entrances, screening people to come into the hospital. These are jobs that didn't exist before, so some of those jobs are being filled by our displaced workers. As far as our capacity, we have, as some of you may know, in our ER, very early on, we created basically a second emergency room area for people with respiratory illness who were not terribly ill. It's out of doors using tents. And then our main ER is for the rest of our emergency room population or very sick people. And that's worked well. Our ER volumes have gone down dramatically. In some ways that's good, in some ways that's concerning. We always worry that there are people out there that have real illness that need care but are staying away out of fear. I want to reiterate, if you think you need emergency medical help, you can get it from us, and you can get it safely. So please, if you really think you have an emergency condition, do not stay away. We have had some patients who have shown up who might be farther along in their illness than they otherwise would have been, and we don't want that to happen, whether it's COVID or anything else. Our ICU, we are in the process of standing up essentially 2 intensive care units. We're using space in our operating areas, and so we will have 1 intensive care unit for non-COVID persons and 1 for COVID or suspect COVID. That is being equipped out over the next couple of days with the capacity to do that early next week. We're well stocked with ventilators currently. If we use all our regular ventilators and we have some emergency ventilators that wouldn't be normally used, and then we can use some of our anesthesia machines as well. We have the capacity to ventilate up to 30 people. As I said, right now we have 3 COVID patients on ventilators, and so we have some capacity there. People wonder about our protective gear. It depends. Protective gear is not one thing. There's 2 different kinds of masks. There's gloves. There's surgical gowns. There's face shields. Protective gear is the most emotional thing. We're working on strategies to conserve. We actually are putting up strategies that we can reprocess and disinfect N95 masks, and that extends our supplies. At our current use rate, we should be good for a number of weeks. Of course, if the surge comes, that use rate will go up, and we don't know when our supply lines will open up. We're getting some hints that there are some deliveries coming, but until they're on the ground, we won't know. Let's see. I think that's all I'll say about the status at the hospital. I think people ask us about, the governor's plan for the New York State. We were tasked with providing a survey of a wide variety of gear, ventilators, our capacity, our staff. We did that earlier this week. We watch the news like everybody else. We know that that the possibility is there that we will be asked to provide equipment or staff. We don't know at all what that looks like. We are also, the possibility might be that patients would come up here. So we have a surge plan. Our surge plan is around space and staff, and we can handle an additional 70 over our normal acute care capacity. We supply that information to the state, and we will find out what they want us to do, and we will work with the state to the extent that we can. So with that, I have no further comments, and I'd like to introduce Erin Strife from the Clinton County Health Department. I don't know your exact title, Erin. I will say that this whole COVID thing has given me the opportunity to meet some really good new people, and I went from not knowing who Erin was to having her on my speed dial on my cell phone. We talk very frequently, and she's been a great partner for CVPH, and Clinton County's lucky to have her. So, Erin.
Thank you, Dr. Ritzman. I'd like to say likewise, you've been a great partner to us, so thank you for that. What I would like to start with is, now that you've heard a little bit about the hospital, I'm going to talk about how most of us are going to care for ourselves and our family members in the home. Quickly, I will let you know we're up to 29 confirmed cases as of this morning. We have 17 recovered. We are starting to work with community providers who are reporting by their best clinical determination suspect cases to us, so that we can further improve our ability to work with contact tracing and encourage containment within the community to the extent possible. That is ongoing work, and we're going to just keep doing as much as we can on a case-by-case basis to contain the spread of the virus. But we do need everyone to continue to stay home. So most of us who do get this are going to be able to safely remain at home for the duration of our illness. What we're going to do is, first of all, know the emergency warning signs. There are cases when we're going to have to go to the hospital, and those include trouble breathing, persistent pressure or pain in the chest, new confusion, or if someone's not responding the way they normally should be able to respond, and any bluish tinge to the lips or face that indicates that a sick person is not getting the oxygen that they need, and they have to immediately go to the emergency room. And in that situation, you would call 911, you would let them know what's going on so that they can put on the protective gear that they need to respond. And that situation, a person would go to the hospital for care. Now, in the home, we're going to first and foremost remember that we're preventing the spread of germs. Just because one person is ill in the home doesn't mean everybody has to get ill. It's not inevitable. So infection control in the home is going to be really important. We are going to, the extent possible, have the person who is symptomatic, who is ill, stay in their own room with the door closed. If there are windows in that room that can be comfortably open for some ventilation, do that, as long as the temperature remains a comfortable temperature for that person in the room. We're going to avoid sharing our personal household items like dishes and towels with the sick person. We're going to, if face masks are available in the home, have the sick person wear a face mask when they're interacting with other people. Face masks need to be conserved for healthcare providers as much as possible. That said, if there's a cloth face mask or another type of cloth covering that a person with symptoms can wear to prevent the spread of their illness to others, that is recommended. If the sick person does have to go outside of the home, they should also wear some type of covering over their nose and mouth, again, to prevent symptoms. So again, caring for the person in the home, we're going to continue hand washing. We're going to wash our hands after we interact with the person, but then also just frequently throughout the day, and avoid, of course, touching our face and nose and mouth so that we're not giving ourselves or inoculating ourselves with the virus. We're going to clean all surfaces throughout the day frequently with an EPA-approved cleaner. I do want to add a caution here that we not mix chemicals. Bleach and ammonia do not go together. Bleach and vinegar do not go together. Those produce very bad chemical reactions that can be extremely toxic. So don't mix your chemicals. Use an approved cleaner to continue to clean the frequently touched surfaces in the home. Wash laundry thoroughly on the highest setting that is appropriate for the article of clothing that you're washing. And avoid, of course, having unnecessary visitors. That should be all of us right now anyway. We should be, to the extent possible, remaining at home. If we, like the people here, have to go to work, we go from work to home. We minimize contact with others. We're not visiting our friends and relatives. We are staying home. Just to get back here to the symptom treatment, so the sick person is going to need a lot of fluids. It's really important to stay hydrated. And what we mean by fluids isn't just water. Really, it's whatever appeals to that person, whatever they're going to continue to take into their bodies within any potential dietary restriction. So of course, if the person who's sick is diabetic, they should be watching their carb count, not having too much sugar, or if they have heart disease, they should be watching their sodium intake. But within that, fluids that might be appealing to someone include ginger ale, chicken stock, warm teas, maybe with honey and lemon, whatever's appealing to the person that they're going to get into their body. Something with electrolytes like Gatorade would be recommended, so that's going to be essential that they stay as hydrated as possible. Over-the-counter medicines may help with symptoms like the acetaminophen or Tylenol, and typically symptoms last a few days and then they get better after about a week or so. So the next really important consideration here is if someone is sick in their home, when are they considered able to no longer be in isolation? There are 3 main criteria for this. One is it has to be a minimum of 7 days after symptom onset. It also has to be at least 3 days since they've had a fever without using fever-reducing medications, and their symptoms have to be improved for the most part. Lieutenant Nick Leon is up next, and I'm going to just say, as he's walking to the podium, a reminder that we're all in this together. We're all interconnected. We're all going to continue to do our best for ourselves and our families, and that is also going to be our best for our communities. And I'm going to let him follow up with some additional words of inspiration for all of us. Thank you.
Good morning, everybody. I was asked to speak to you all in regards to the role of law enforcement during this crisis. Police officers are used to being in situations that are stressful and dangerous. This is no different. We, as law enforcement, are here to respond to all the calls we did before. We're here to help you. We're here to go to the calls where you have concerns about neighbors. We are no different than your state police, the city police, the Border Patrol, and Customs. We will continue to work through this just as we always do. Fire, EMS are also responding. You will have somebody answer that call. There's some rumors going around also I was asked to address. Law enforcement's out looking for people driving on the roads. We want to write tickets. We want to arrest people. It's not the case. We want to enforce the rules as they exist. We want to encourage people to stay home. We know there's essential workers out there and that you have a job to do. The rest of you, stay home. We don't need to be out running around. We don't need to cause our emergency services to get depleted to go to calls where you shouldn't be at. We understand being home with your kids and your family members more than you normally want to be is stressful. We get that. We have families. Do your best. If you need us, call. Something else that was brought up in regards to testing that keeps coming up. We have 29 cases. That's a sampling of the county. The doctor explained the strategic plan on who they're testing and how they're testing. That's going to yield a small number. I was looking for ways to explain it as I spoke with Sheriff Favreau. The easiest thing I can think of is this. You guys take your kids out trick-or-treating. They have a bag full of candy. You come back and you simply ask, hey buddy, how much candy do you have? Your little guy reaches in with his hand, pulls up a handful of candy. He says, this much. It's not true. He's got a whole bag of candy. We're testing people strategically, but that is not indicative of those people that could be out there still sick. And yet we still have people going out to all these different locations, sharing germs, getting close to each other. You can fix that. You might be okay. I might be okay. But we all know somebody who may not be. And you won't know it. The time frame is different. You can pick it up, share it, and never know. But you have a chance to protect your loved ones, my loved ones, and do your part. There's 2 dates that I want to bring up because it's a difficult and scary time. And only one of these I lived through. December 8th, 1941. September 12th, 2001. That's the day after Pearl Harbor and the day after the attacks on the World Trade Center. A lot of you remember those. Those are dates when communities came together. Towns, villages, people. We realized what it meant to be one. We wanted to take care of each other. We were looking in on our neighbors. We were doing our part as Americans. We went to work when work was needed, and we did what we needed to do to succeed and take care of each other. This is no different. You have a chance to help people by simply staying away. We can't track this thing very well. We're doing our part. You have all the healthcare workers doing everything that they can. There's still a chance. We're not on top of it. They're trying. They're exhausted. They're doing everything that they can. Stay home. Help them out. Give them a break. Take care of each other. Just like these events before in history, we're going to be okay. You're going to be fine. Take a breath. You guys can do it. You guys are doing great in this room. You guys are doing well at home. Keep it up. With that, thank you very much. And I guess we'll get to the questions.
Okay. One of the first questions we had is why can't local labs read the test results? So I think that was for you, Doctor.
So the question is, why can't local labs read the test results? I think what that means is, why can't we test here locally? We can't yet. The development of FDA-approved testing really only happened over the last month or two. So right now we're limited to using the state lab, which is one of the best in the world. If people don't know, the state lab is one of the best labs in the world. There are commercial labs that you can send testing to. We have not chosen to do that because our limitation on the ability to test is not the lab. Our limitation is the collection kits. So whether we send it to a state lab or whether we send it to a commercial lab, we're still using a limited supply of testing kits. And the commercial labs don't have nearly the good turnaround that the state lab has right now. Commercial labs are turning them around, from what I'm hearing, at 5 to 7 days. There is technology out there that is being developed that would allow us to test in our lab. We, like almost every other hospital in the country, has put in orders with the company to get that technology. That company just got their technology approved about 2 weeks ago, and I suspect they're having a devil of a time meeting the demand for the supplies to do the test. When we have that available in our hospital, that will be a wonderful thing for everybody, because we will be able to get immediate turnaround on our testing, which certainly in the hospital would be great. Right now, our best option by far is sending to the state lab. It's not really even close between the state lab and the commercial labs at this point.
One of the other questions for you as well while you're up there, sorry, who controls how many test kits that we get within our community?
So we get our test kits from New York State. The question was who controls where we get the test kits. We get our kits from New York State, and they come through the Office of Emergency Management. That's where we are right now. That's one of the data elements that we report to the state, how many we have. And I think that if we were to get to a point where we didn't have kits, even for hospitalized patients, we would work through emergency management. At this point in time, we have enough to meet our hospitalized patients' needs for a number of weeks at least. So.
One of the other questions was in reference to the ICU beds. Somebody asked specifically, how many beds do we have?
Well, we are planning for as many as to be able to ventilate up to as many as 30. But the question is always more complicated than that. Just because you have 30 ventilators, you have to have 30 staff that are trained to deliver care with ventilators. So, our surge capacity involved a doubling of our existing ICU beds. Our existing ICU beds are 14, so our surge capacity involved 28. That's our capacity. Again, we will flex to meet what we need to meet, obviously, but it's not just space and it's not just ventilators, it's staff as well.
Aaron, I think this might be a question for you. One of the questions was, what should individuals, are there recommendations for individuals re-entering the home after leaving for supplies and or for essential workers after they have been working when they're coming back home?
Last press conference, I went through how I personally re-enter the home. I don't have a simple infographic from the CDC or the New York State Department of Health, but I can say that I personally, when I return home, take my shoes off at the door, wash my hands, shower, immediately wash all of the clothing that I had on and the towels, and then I go through the entire household at least twice a day and disinfect the surfaces that I reviewed earlier.
Related to contact tracing, what has contact tracing shown us and how many people are being monitored or tested?
Contact tracing has shown us that there is definitely community spread, and it is not easy to determine where people may have been exposed, and when I say not easy, I mean frequently not possible to establish definitively where a person may have picked this up. So we know it's in the community. We know that the transmission is ongoing. As far as numbers go, we again have 29 confirmed positive cases, but each of those cases then have high numbers of contacts who we follow up with to determine their level of risk and whether they need to be placed in isolation or quarantine.
There was a question when the numbers were reported, does the 29 positive individuals, when we say 17 recovered,
7, not
7. Okay, so they heard 17, so 7 recovered. So does the 29 include the 7 that have recovered?
Yes, so whenever we report the number of positive cases, that's the number of confirmed lab results that we've received to date. That number will always be a running number. We will never subtract anyone out of that number. So if they've recovered, they're still counted in that number.
One of the last comments that I'll say, we're getting a lot of comments overall from Facebook viewers, concerns about, so the governor reportedly said in his news release that he's issuing an executive order to take PPE and ventilators from hospitals across the state that are not currently being used. So there are a lot of different questions and concerns from the public about what happens when those equipment items are taken from upstate New York and our community needs it and it's gone.
I understand that we want to protect our community. But I also want to reiterate that we are all connected as a human species. We are globally connected to each other. Right now, if there are people who need these resources and they will live because we're able to provide these resources, it is our moral imperative that we help people live, whether they are in Clinton County or whether they are in any other location. If we can help them, we will help them. Helping stop the spread in other locations also helps to stop the spread to us. So we have to help everyone who needs help to the best of our ability at all times.
I have two questions left that we will read. Are the local counties coordinating for the North Country?
Yes, I'm not sure exactly what that question means, but we are working with our partners in other counties, yes.
The last question had to do with a county-wide order. It's been said that many residents are not following the recommendations to stay home. Is there any talk of issuing any other kind of county-wide orders for residents to make them stay home?
I'm going to defer this question. Thank you.
Actually, I'll take a stab at the previous question as well as far as county coordination. The emergency management offices in our region, in particularly Franklin and Essex, we're in communication with them every day. They are running operations in their counties similar to what we are doing here, and we do communicate within those counties as well as other regional counties through text messaging, through emails, and a conference call. At the county administrative level, I know that County Administrator Mike Zerlo, here in the room with us, he attends New York State Association of Counties events, conference calls on a routine basis as well. So that covers statewide coordination among the counties. So I think that answers that. What was the second question specifically again? Executive orders locally with regard to staying home. The answer is no. At this time, the executive orders that were put in place with the county's state of emergency do not address that specifically. Our request, you've heard over and over again from everybody that's been at the podium here today and at our previous events, that we implore folks to listen to our plea to continue to socially distance, to stay home, to only go out when you need to for medical reasons or for necessities. Stay home, stay away. There will not be any executive orders in that regard at this time coming from the county. In fact, an executive order issued by the governor of the state of New York prohibits us from actually doing executive orders related to COVID-19 without their approval. So at this time, we have no plan to issue something of that nature. We just simply want to ask you folks, as has been said, stay home, stay away from each other, stop the spread of this thing. Thank you.
One of the last questions we have, what are some precautions being taken in correctional facilities to protect staff, officers, and inmates? So a similar question. Are we worried about COVID-19 spread coming from correctional facilities? Just from the same person.
All right. Second one, are we worried about COVID-19 in the correctional facilities? Yes. We're worried everywhere, globally, across the state, across the country. In any environment, we have concerns about it. Well, inside the facility, and I don't work directly for the Department of Corrections within our Sheriff's Office, but I am aware of what's going on. Officers have been offered the PPE. They are there. They have been given the opportunity to use it when they need it. They're screening on inmates coming in. As for the State Department of Corrections, if you read the news, you have their unions speaking up. Assemblyman Jones has been in the news lately supporting that. So that information is out there. I can't speak directly for docs, but it is a concern, and they do want the officers protected. They do want the inmates protected. We're all humans. Nobody is exempt from this. Everybody is worried. So we want to make sure that we have that equipment.
Thank you for joining us today. We hope that we were able to answer some of your questions. I do thank our speakers for the remarks that they brought to the table. We will continue to provide information to you and respond to questions as best we can. Thank you.